Okay, I like that. Now remember, her problem, she don't complain here. Her problem is up here. But I'm going to fix this. If you do before and after, it's mind-blowing. I'm going to fix this by fixing this, then fixing this. So then we do movement palpation and pain point. Okay, any tenderness?
A little bit.
Of 1 to 5?
1.
1. L5 is 1. L4? L3? L2?
No.
L1?
No.
Okay, I'm on the spinous processes testing to see if the vertebra has shifted forward or backward. I'm on the spinous process palpating. If it's tender, my opinion is that vertebra has shifted backwards or forwards, anterior or retro. Now let's go to the transverse processes. Remember L5 was like 1, 2. L5.
Yeah, that's like a 2 or 3.
She jumped. L5 on the right. Let's go to the left. L5. Nothing?
No.
No. Let's go to L4 on the right.
Yeah, it's still a little.
Let's go to L3.
A little bit.
But mostly L4, definitely L5.
Definitely.
On the right. Okay? Is it primary? Well, let's find out, because I haven't adjusted the pelvis yet. All right, so pelvis. Put your right palm here, right palm of your hand here.
Mine? Oh.
Yeah, okay? And put your left palm here. All right. This elbow lower and flatter. This elbow more bent, okay, and elevated. This is low, this is high, correct? It's very obvious by her elbows. All right, put them down. Let's go to the ischium. And the ischium's not here, doctors. This is the ischium down here. Don't be afraid to touch here. This is where the ischium is. This is where the coccyx, sacrum, ischium's not here. So you check ischium left, ischium right. That's a 1/2 inch. Higher here, lower here. Can you see that? Okay. So according to her spine, I have to fix this. Not bad. It was worse yesterday. All right, so I prop up the anterior pelvis side, which makes the adjustment for me. You notice in the wedge technique, and we'll find out more about that. I'm using the wedges different places, and we'll show you again later when I sit her up. Wedging a pelvis, anterior to posterior, posterior to anterior, depending on the position of the pelvis, corrects the spine all the way up to the occiput and down to the feet. Now she lays there and breathes for a little while. They actually change together. So this is called a passive adjustment. I mean, you people at home don't have a chiropractor, just by putting a wedge in the right place, on the right or the left, supine or prone, in other words, face up or laying down, you lay there and you adjust your spine as you're laying there. Go to sleep, adjust your spine, wake up, and it's going to be helpful. Will it fix you? Well, I don't know, but it's better than the wrong adjustment, and it's non-aggressive. All right, so let's get the ischium. Assisted drop, in other words, okay, I use my knee to set the table, and my hand comes in at the end. I get a 300-pound football player. I put the table up, crank it up as high as it can with resistance. Do I want to come in and bam? Guess if I'm going to break his pelvis or break his ribs. A lot of broken ribs in football lately. No, I do an assisted drop. Drop, and your hands comes at the end. Your hands come at the end, okay? Now let's do the pelvis, because it was anterior. All right, and palpatory. I need to touch down here, okay?
Okay.
All right, let's find the tailbone. Here's the apex of the sacrum. Here's apex of the sacrum. We actually, tender right there? We actually have a right apex of the sacrum. Now understand, anterior pelvis, Left hemipelvis is LAIN, left anterior nominate, okay? Ischium is high. And the tailbone, the apex of the sacrum, coccygeal area, usually it comes left with this configuration. This one's going right. It's trying to compensate, okay? You see her belt, her pant line shows that her pelvis is anterior to the left now. So this is low and this is high now. That's fixed. Put your hands here. Okay? Now this one's lower, this one's higher, right? Just a smidge, you feel that?
Mm-hmm.
Yeah. But she insists that she wants these to be even. Because, you know, your pants, if you're wearing nice pants around, you, okay, never mind. So what I want to do is I want to get the apex of the sacrum. Now I would normally do it on this side of the table, but for purposes of demonstration, we'll come here and bring it over. Did it work? Yeah, it did. No more pain. Okay. Okay, now put your hands here. Perfectly even. So, okay, no, elbows symmetrical, perfectly even. And guess what? Look at her left shoulder and arm. It's working. Whoa, it's working. So subconsciously I had her do this, right? And she had no pain in her left upper extremity shoulder girdle. Okay, put this back now. That's beautiful. Let's check the leg lengths. Leg lengths are even. Can you see that, man? Okay, and when I bend, there's trying to be a positive deer field, but it's just minimal now on the left. Bend. And the left hip, you don't see it, but the left hip is just a little trying to pull me in. So that pelvis adjustment, I believe, balanced the pelvis, normalized the flexion of the knees, which tells us about deer field. All right, and let's see what it did to fifth lumbar. Any pain? No pain?
Not really.
Not really. That was that one I touched that was 2 to 3, correct? Right here?
Yeah.
And it doesn't hurt anymore, right? Let's go to L4. Anything?
No.
Now let's go to the right side here.
Yeah, that's way better.
Still painful?
Not, like maybe a 1.
Oh, a touch, okay? So fixing the pelvis corrected the vertebra that might have been anterior or posterior. Because remember, when a vertebra rotates, it doesn't just laterally rotate, it shifts because of the facet facings. Bumble bum. Bum, backward, upward, medial. Backward, lateral, backward, medial. Facet facings. That's why if the facet facings are out of alignment in the lumbar spine because of a short leg syndrome and a pelvic rotation, and the facets are already jammed, why are you laying them on their side and crunching them? You're jamming the facets. Are you tired of your patient telling you, you know, I was good for that one day, doc, but damn, man, next day I'm hurting really bad. Are you jamming the facets? Well, yeah. You got to adjust along the facet, not against the facet, or you run it back. So she still has a little bit L5 going on, just a touch. Not much, but let's make sure it's gone completely. I prop up this side. Then I come here, I lift the pelvis up, which is below L5, to bring L5 closer to me. And then I come to L5. Scissor movement. Scissor. Hook the vertebra with your outside of your palm. Hook it. Bring it down. Boom. Why bang at it? You can if it's posterior, if it's a posterior subluxation. You can if it's back here and it's posterior and you have a rotation. This is lumbar spine. You got one vertebra. Okay? You drop it with your knee. Bang. You rotate the vertebra. You rotate it. Okay? Anything? Gone. This isn't her complaint. Okay? It hurts so bad here, she don't pay no attention what happens here. Am I right?
Right.
Right, she says, right? All right. Now let's go up the spine. movement palpation for vertebral fixation. 3, 2, 1. T10, 12. 12, 11, 10, 9. Tip of the scapula, 8. The inferior tip of the scapula, usually 8. Unless scapula is way out of alignment, which can be, then guess. 7. This is where it starts getting touchy, right?
Yeah.
Right at the bra line, interestingly enough. Can that cause subluxations? Well, yes, it can. It's a constant irritation on the neurometric segment. Do some people wear these bras with a bigger strap so it covers more of an area? Yes, they do. But here it's T7. All right? Let's check your scapulas. Right scapula? Where is it? Here's your left. Oh, she's ticklish. All right, here's your right. Left scapula low, right scapula high. Okay? Tender here.
Yeah.
And the ribs on the right side. Tender here.
Yes.
On the left side. So I'm finding a fixation here with rib and muscular involvement. Let's go up. T6, 5, they're all stuck. None of them are moving. All T7 to T1, not moving. So, and it's general at this point, but I'd like to give her some movement. On your back for me, please. So I'm just going to loosen her up and see what happens. Then I'll go back. You have your left hand. Do a sit-up for me. Okay. Protect yourself, doctors. Get low and tuck in your belly. And just generally release. What do we call that, Dave? We call that the tonic adjustment, isn't it? Or? Yeah. Tonic adjustment. It's non-specific. It's just to loosen up that rib cage because it's been fixated real hard. Face down again. I told you I'd make you a star. All right. Let's go up again. Tip of the scapula, T8. T8. 7, better. 6, 5, 4. T4. Real bad, isn't it?
Yeah.
The fourth thoracic now is the real fixated vertebra. I touch it and it's real tender. Fourth thoracic. Can you follow me here? Fourth thoracic. Gallbladder, jaundice, shingles, liver, fevers, low blood pressure, anemia, poor circulation, arthritis, skin problems, fatigue, stomach problems, nervous stomach, indigestion, heartburn, dyspepsia, ulcers, gastritis, blood sugar. Okay. T2 to 3. Heart conditions, chest conditions, bronchitis, pleurisy, pneumonia, congestion, influenza, asthma. C7, T1. And the neck, laryngitis, hoarseness, throat condition, sore throat, quinsy, stiff neck, pain in the upper arm, tonsillitis, whooping cough, croup, bursitis of the shoulder, cold, thyroid condition with asthma, cough, difficult breathing, shortness of breath, pain, numbs, tingling into lower arms and hands. Bingo! So this is what I'm working on. Doesn't just fix her structure and her range of motion, it's confirmed that sympathetic nervous system, parasympathetic nervous system, and nerves are involved going to different areas of her body, not just her spine, her arms, but organs, heart, lungs. So T4. Tender as heck, isn't it?
Yeah.
Yeah. We'll get back to it. T1 good. T2 good. T3 good. Oh. See, this is not hurt here, does it? This one, it's right there.
Yeah.
Ooh, like a boil, isn't it? That's her. You have stomach problems?
Yeah, I have like 12 of those things you listed.
I got 12 of those things you listed. Oh, so what I read out, she has 12 of them. Mm-hmm. This lady, after how many years? 2, 3 years?
4.
4 years. We talked internet. We talked on the email. And we talked on the phone. Hi, I'll try to help. Just give me some time. Travel here from Florida. Okay? On your back for me, please. So let's specifically go to T4 and C. Now, if I can just mobilize it. There we go. Come up one more time. Face down for me. Still there, isn't it? Didn't work. A gentle, general mobilization. It said, no, I'm not working. T4, trapezius muscles, different muscles, levators, everything attached to T4, T5, a lot of different tendons. So now let's do this. Sit up with your back to me, please. Yeah, it's a girl, sit in the middle. All right, so sternoclavicular joint, high, low. That was so high yesterday, I didn't know how she even moved her arm. Right clavicle, left sternoclavicular joint. Is it about a half an inch? I can't see. Higher here than it is here? Quarter to 3/8. Let's split it in the middle, right? 3/8 of an inch. It was like this yesterday. This sternoclavicular joint was up in her throat. Clavicle articulates with the acromion process, or the coracoid process, at the acromioclavicular joint. So if this is rotating up, the sternoclavicular joint and scapula should drop down, which is be compensatory reaction. So in the back, I actually have a high scapula on the left and a low scapula on the right. And at this point, she's feeling so normal, it's hard to imagine which arm it would be. So which arm was it?
This one.
Left. Left. Okay, pain in here, numbness all the way down your arm, right?
Yeah, especially on the back.
Especially on the back, which is C7T1. Because the left sternoclavicular joint is higher, okay, and the left scapula is higher, that makes no sense at the AC joint. It's got to be jammed and tender because clavicle up, scapula up. Furthermore, sternocleidomastoid muscle saying, hey, what's going on here? If this is all out of alignment, the SCM is on fire. Sternocleidomastoid muscle, sternum, clavicle, mastoid, pulling the head. So do you mean you can adjust the atlas and occiput by fixing the clavicle and the scapula? If it's involved, if the sternocleidomastoid muscle is involved, absolutely. How do you know it's involved? Hello, touch it. Is that tender?
Yeah.
It's involved. Okay, so now I have a real high left rib. I have a real anterior first, I have a high left elevated first rib. I have an anterior first rib. Real tender? Mm-hmm. When I push here, does it cause any symptoms into your left arm?
No, not right now.
Good. Let's go out further in the thoracic outlet area. Anything? Okay, now, this is a difficult adjustment, but I don't want to be very traumatic. Let's do the wedge technique. On the short leg side, pelvis is, if it's corrected, will be anterior. If you have a lot of complications, it become posterior, but under normal circumstances, in a compensatory relationship, the pelvis is anterior on the left. To bring the pelvis posterior on the left, a wedge. How much of a wedge? Do 2 inches. See what happens. Then I wait, let the body correspond. I'm changing the pelvis and the sacrum. All right, now let's go back to the clavicle. It's even. Yes or no, Dave?
A little bit high still.
Does it look, it feels different to me, okay? Close to even. So it moved it moved, right? All right, let's do the first rib. Any pain?
That's better.
That's better?
Yeah.
I didn't do anything to it. It doesn't matter, does it? Let's go to this first rib.
Yeah, it's a lot better.
It's a lot better. All right? Why, if I put this wedge under the right pelvis, should it correct the thoracic outlet and cervical rib and the neck and the cervical spine? Because when you change the structure balance point, you change what's above it. Right? So do I leave it this way? Yeah. So I'm going to adjust the first rib now. Because this wedge just made 70% of my adjustment. So first rib down, and my leg is on the table. First rib That's anterior, anterior to posterior. Okay, we tap this one, all right? Now, any pain here?
A little bit.
Any pain here?
Not really.
Okay, how about here? Still tender right there,
Yeah,
isn't it?
a little bit.
A little bit. All right, let's take the wedge away. Okay, give 10 seconds. Innate intelligence, innate, subconscious, spiritual, unpredictable. You can't control it, it's what you feel. If you can't feel and connect spiritually, why are you working on this person? So what I'm doing, you can follow all the rules, but you have to have an innate feeling of what this person's energy is telling you. This is my patient. I'm trying to show love and respect and kindness and fixing her. Innately, inside is the truth. Her truth is trying to communicate with me when I touch her. I don't mean to sound weird, but this is the way it is if you're using your hands all the time, doctors. I bet you surgeons pray before they go in, right? So the energy is like, oh, thank you, Dr. Vetanze. Since I like you, Dr. Vetanze, and I'm starting to trust you, can I reveal more to you as you work on me? So I'll be working on her. I'm like, oh, I see, and do something else. So right now, left shoulder's head of the humerus is anterior. So we get this, and put the head of the humerus back in position. All right? Okay, then put this here, and we drop sternoclavicular joint down a little more. All right? Now we're even. Dave? Now we're even at the sternoclavicular joint.
Yeah.
Now here, minimal, right?
Yeah.
Here, minimal, right?
Yeah.
All right. Neck. Left neck. Posterior cervical. You go see, the works to palpate somebody's neck, there's no muscle there. It's dehydrated, flattened, plastered to the cervical spine. It's like, and if I pinch it, ouch, right?
Mm-hmm.
Now let's go to the right. Nice fluctuant muscle, big old muscle. Well, wait a minute. That's the sternocleidomastoid muscle. Oh, that feels pretty good there, doesn't it?
Mm-hmm.
Well, there isn't one here, but there is. But it's so plastered from being out of position that I squeeze it. You don't like me when I'm doing this, do you?
It hurts.
It hurts.
Yeah.
Well, Dr. Vetanze, you said structural alignment will take care of all that. Well, it will, but isn't it better to try to do it quicker by working on the muscles, which are the levers of the structure? And we have Wes, the physical therapist, and you come here, you get me, you get the machines, you get the laser, you get the athletic trainer, and you get Wes, who does the functional activation of the muscles. So he comes into these muscles, wakes them up. All these muscles are too short, too long, angled wrong because all the structure, the origin insertion points of these muscles have all changed. So all these muscles are like trying to adapt. Ah, there it goes. So if I keep squeezing this muscle right here, there it is. It softens, and now you have muscles. Okay, even. All right. Let's do one last thing. On your back for me, please. Okay. T4. First rib, second rib, third, okay, fourth rib. Anything?
Yeah, it hurts.
Tender?
Yeah.
Okay, fourth rib. Nothing. This is a new one. Fourth rib, and it's concave, it's flatter here. It's flatter here because the spine is convex to the right. If the spine is convex to the right, the rib heads move back and give you a flatter palpation in front. If the rib heads are shoving forward, ouch, right? Mm-hmm. Then this thing is sticking her right there. T4 rib. So, we come to the fourth rib. Okay. The first 6 ribs are bucket handle, freely moving. All you gotta do is tap them and they go in place if they're ready to and if it's in the right order. Okay, let's go to the fourth rib. That's ridiculous, isn't it?
Yeah.
Completely gone. So, that tricky area at T4, which is your stomach, Sit up for me. Lay face down again. Of course, if they're in excruciating pain, you got to shortcut it. I'm having to move around a lot because I'm trying to teach and treat at the same time. Scoot back just a little. Okay? All right, here we go. There's T4.
Yeah, it's much better.
Tell me?
Much better.
Don't just say that.
Well, I was flinching before.
It's much better.
Mm-hmm.
And it's the fourth T4. And it's moving. And its rotation is gone. But it's still anterior. So this stinky vertebra here, like what? Oh, everything's fixed. How do we know we have left? This is T4 after I fixed the first and second rib. That's amazing. This is an active, this thing is a problem right here, this T4. Now let's fix it. Sit with your back to me. You know, put your feet this way, and I'll show everybody what I'll do. Okay? T4, and it's almost, it's flattened here. She has a flat spine here. See that? She starts getting her kyphosis, more here, it flattens out here, Pottinger saucer type. So this vertebra, I read you what it can do, right? So let's get Kenzo Kazi. Mr. Kinesio Tape taught me this adjustment. Hi, Dr. Kazi, how are you? I hope all is fine. Okay, I get a towel, T4, I put it below T4. I want to push these vertebrae in that are posterior. These vertebrae have to be more posterior because this one's anterior. This is the kinetic movement and the attempt at the body to have perfect posture. One thing goes one way, the other thing goes another way because gravity's pulling you down. You're trying to balance and you're trying to be perfectly upright in this universe. You don't have a choice. That's how God made you. All right, so I then put my chest into the towel. Both hands behind your neck.
Right.
Lock your fingers. And elbows together.
Oh.
And I put the fourth thoracic back in place. But I pushed in at the posterior vertebra at T5, 6, 7 in an attempt to lift it, push that vertebra in with my chest, have T4 come backwards and get in a line.
That was a big one.
That was a big one,
Yeah.
wasn't it? Okay, face down for me. All right, let's go. T1, 2, 3, 4, 5. Little to nothing, right?
Mm-hmm.
You happy?
Yes. Very happy.
Very happy. Now, she giggled after that treatment. She giggled and started laughing. Endorphin. Well, if you give an adjustment and they scream out, cry, and start bawling and writhing in pain on the floor, you probably did something wrong. If you give an adjustment and they burst out laughing and you feel the energy release from their body, you should feel this innate intelligence. It'll communicate with you and it'll give you a thank you if you do the right thing. They start giggling and laughing, some hysterically. Oh, because the energy is released. Okay. Sit up for me, my dear. Stand up. Walk around, see how you feel.
It's a lot better.
Tell them.
It is a lot better.
Okay, now, how many years?
4. That it's hurt really bad. It's probably been longer than that.
And you were like at wit's end.
Yeah.
And you flew here and spent lots of money on the plane, and I'm sorry about that. So from Florida, you came here, wit's end, not knowing what to do. This is your second visit.
Yeah.
You can feel your life starting over again, can't you?
It feels so much better.
All right.
Yeah.
Anything you
so
want
much.
to say to anybody watching? There's people. There's 3 million views. There's 9,000 subscribers. 9,000 people are going to watch this. What would you tell other people? Go see your what? Tell them.
I mean, literally everything that you did is nothing that I've ever had at a chiropractor before, and I've been to lots of chiropractors. And I didn't even have to tell you where it hurt. Like, you would just say, this hurts, right? And I say, yeah, that's, like, that last thing that you adjusted was where it has been killing me for 4 years. And it feels so much better. So much better.
Okay, so You think it's better than me being a detective. And since
Yeah.
I know the structural system, what it's supposed to look like, to listen to your symptoms of pain, but not make that my goal.
Right.
My goal is to have your body heal itself by me balancing you out. And if I know what's supposed to be in balance and the way it's supposed to be, you don't have to tell me. You couldn't tell me your navicular bone was out, could you?
Mm-mm.
You couldn't tell me your ischium was elevated, right? Even if you knew what an ischium was.
Which I don't.
Okay? I have to feel it. You have to feel it objectively. Understand and accept their complaints, their symptoms. Don't make it primary. That's your goal. Or you're no better than big pharma, giving them a pill for the pain. Okay? And you were so bad. What do you think would have happened if I adjusted everything wrong? Hate to think about it, huh?
Yeah. I don't think I could have moved it.
Okay.
So,
Move your arm over your head.
yeah, that's actually a huge deal.
Okay? Now left hand.
Oh.
Yeah! All right. You got a question?
Okay, so for much longer than the 4 years, I've been cracking my own neck, my own back, and just when I lay in bed, if I like twist the right way, I can like crack my lower back, and it feels really good. And I do it sometimes without even realizing. Is that making it worse?
I think like a Pilates or like a yoga, you go through those various movements. You don't use a lot of force.
Mm-hmm.
If there's little stretching techniques, okay, it's okay for you. I see these kids all the time go with their neck. I go, oh my God, don't do that. Or go with their back. You can hurt yourself, yes.
Okay.
That brings up one more point. You want to do this because functionally you're just all messed up and you're tight and you want to get it fixed.
Mm-hmm.
Say you asked me, Doc, should I exercise? I said, Brookie, your back's out of alignment, your right leg's 2 inches short, the pelvis is all twisted, the shoulder girdle's twisted, you're non-functional right now. You can't function, you're getting hurt, you're having all this pain. But then you go to a gym and you do all this exercise. You get a dysfunctional alignment, structural alignment. You get a dysfunctional functional alignment with all the muscles and tendons being either too short, too long, or rotated wrong. And you're going to the gym making them stronger. Mm-hmm. So you're enhancing that misalignment. So does that mean you shouldn't be doing heavy exercise if you're out of alignment? Yeah, you shouldn't. You're going to hurt yourself. Blow out a knee, pelvis, hip, shoulder, something. Mm-hmm. Now, when you're in perfect structural alignment, and then you start exercising all those muscles, and the muscles turn on like Dr. West worked on you and turned all those muscles on, then you're ready to go. You can then protect yourself, build yourself up, and fire those muscles symmetrically if you're in structural alignment. Anything else? One more?
I don't think so.
All right, honey. I love you.
Thanks.
Thank you for being here.